Good afternoon, ladies and gentlemen. My name is Josh Epstein. I'm the marketing specialist for TDA Perks. And the title for today's webinar is The Member Mindset, Understanding Healthcare Consumerism and Attracting Your Ideal Self-Pay Patients with the Dental Membership. So our presenter is Eric Dawe. Eric is the founding partner at DentalHQ and VP of Business Development with 16 years of experience in healthcare and consumerism. He's here to discuss increasing patient care in your community and building loyalty, through membership plans for both your uninsured patients as well as your insured patients. So before we get started, I'd like to remind you that TDA Perks offers members over 20 other vendors like DentalHQ, and that ranges from compliance and supplies, insurance, HR, marketing, and financial and real estate, all designed to assist you and your staff. So lastly, I'd like to make sure you're all familiar with the latest member benefit from the TDA, and that is the Dental Concierge CE app. It is a free member benefit, and the app lets you track the CE you've completed and see what you lack. It allows you to get high quality courses you need at a low cost, and it lets you submit seamlessly to TSBDE. Now, our next live course here is on September 15th. It's with Dr. Arthur Jeske, and it's regarding the opioid epidemic and dentistry. Definitely urge you to register for the app and sign up for the class. So you can register for the app and purchase the class all at tdadentalconcierge.com. So Eric, you ready?
I am, thank you. Thank you, Josh, for all your help in setting this up, and TDA Perks and the Texas Dental Association members for joining us today. What are we talking about? So Josh said membership plans. Some of you, I'm sure, are very familiar with the concept, might be running your own in-house plan, self-administering it. But for those that don't know what a membership plan really is, it's for your uninsured patients, and it typically has inclusions of preventive care or perio for, obviously perio is a little different, but adult and child wellness plans would include something like this. It's going to be your cleanings, your exams, x-rays, maybe some fluoride, and maybe a discount off of additional procedures outside of what's included in the plan. It is not a network. It is for your patients, for your particular office or group of locations, and it's based on your full fee schedule. So what we're seeing here is a live office that I pulled a screenshot from, but the $32 a month, 28 for child, 70 for perio. I like this example. It's pretty typical of what we see really all across the South, and even a lot of offices in Texas that are using our platform. So pretty typical pricing and pretty typical inclusions. Now, who comes to us? And I'll get into the background of our company, but what we're getting a lot of inquiries, the types of offices are definitely those offices wanting to drop PPOs, maybe offer up something in its place. I guess the feedback we've received over the past 5 years or so, definitely that the dream of any dental practice owner is to be out of network, to be fee for service only. And a lot of offices out there are actually running their own plans. We get calls from them as well. Maybe it's to help organize and scale the plan. That's really why most offices come to us. But if you're running your own membership plan, we can absolutely help make it a bit better, just with our different features and functionality to again, not let anything fall through the cracks, to help organize everything. And then we have some features to actually help scale your plan, probably beyond what it's doing now. Where this all comes from. We did not come up with the idea of membership plans. If the first two names on here ring a bell, Dr. Charles Blair, Dr. Roger Levin, both of those guys have been lecturing about membership plans for 25 plus years. Brett happened to be sitting in a lecture of Dr. Blair's, and it clicked with him. He said, I have a lot of fee-for-service patients. This sounds like something great that I could offer to them, increase some patient care in my community and amongst my current active charts. Brett is a practicing dentist now with 6 locations, but he started this in his first location. And the real problem that he ran into was the administrative side. He's got great teams, great systems and processes, but that still meant that some patients were falling through the cracks. Maybe they were treating them and they actually hadn't been an active member. Maybe they weren't paid up for that year. Another, kind of little feedback he got from his team was that making the renewal phone calls and just keeping track of anything became very time consuming and tedious as his plan grew. So Brett was looking for automation. He knew that was the easiest solution for something like this, and didn't really find anything on the market that he liked, which is why we built DentalHQ. He is very much our visionary, is our CEO and our founder, but the day-to-day that Brett really provides so much insight on is being a practicing dentist himself. He knows what he wants in his locations and how he wants it run. So we're fortunate to get that kind of visionary role from him. The other nice part is that our advisory board is full of practicing dentists. We get to beta test things and ideas that we either are going to develop or might develop for honest feedback. We are the most endorsed membership platform on the market by different groups, organizations, state associations, TDA Perks program being one of them for the TDA members. And I bring that up because the real feedback we get of why would somebody endorse us, what do they really like about our program and our platform, is the ease of implementation and the ease of use for the front office team. It's something that Brett knows very well, like I said, with his systems and processes in his own team. So we get great insight on that. And the idea behind this is not to make more work for the team. It's actually to alleviate any of those little tedious tasks or extra workload that might come along with running a membership plan. Usually get a lot of head nods out of this slide because it's something everybody on the call is probably familiar with. And like I said, if you're wanting to go out of network with different PPOs, I'm sure everybody right now is thinking of their worst one, right? The one they really want to drop. Maybe it's because of support, maybe it's because of reimbursement rate, but everybody's running into the same issue of not getting an increase in their reimbursement rates over the past 5-7 years, but the cost has gone up significantly, and especially since 2020, right? Increasing cost to patients as well. The actual insurance prices out there are going through the roof for your patients. They're not getting extra benefit. They're not getting extra services. You're not getting a higher reimbursement rate. Guess who's collecting all the extra money, right? So there's a time and place for insurance. We're not suggesting you don't have insurance. We're just a really good option to put in place and offer this up to patients if you're looking to go out of network. We also speak to lots of fee-for-service only offices. I had a call with one this morning that's joining the program. It's a great offering for all. It's really increasing the patient care side. So quick couple other little facts here. It's definitely, we're seeing uninsured patients, retirees, self-employed patients join these plans, but also those that you're already out of network with. They're not getting what they're paying for with insurance for the most part. ADA did a study and found that they're getting only about 70% of what they're actually paying for. So you might have patients that are out of network with insurance say, you know what, how is this membership plan different than my subsidized plan for my employer? There's a lot of bad insurances out there, right? Not a lot of benefits. So you might see some people drop their out of network plan, join your in-house membership plan. Why is it? And this goes back steps away from healthcare a little bit, but then I'll tie it right back in. The consumer mindset and the way we live our lives nowadays is off subscription-based models or out of membership plan models. Costco or Prime are two of the biggest ones out there. I'm sure plenty of people on this call have a membership to one, if not both. And just think about why you actually joined one or both of these. It's to be included in something, to get extra incentives or price breaks. It could be for any number of reasons. And one of the ones, to tie it back into healthcare just a little bit, one of the biggest new subscription-based healthcare platforms out there is One Medical. That's the one that Amazon bought, and it's nothing more than a concierge plan for insured and uninsured patients to join on the internist side, just your basic general practitioner. So where are we going with the consumer mindset? Let's tie it back into what we're talking about today and the consumer patient mindset. So only about 20% of uninsured patients actually see a dentist. We're trying to change that. The number one reason they don't go to a dentist is because of cost. Now, that's a perception of cost. That doesn't mean you're priced too high, doesn't mean you need to discount extra. There's a perception out there that you either have to have insurance to go see a dentist, or that, when you go, it's going to be some, $5,000 bill or something crazy. Preventive care, we all know, is not that expensive. Getting your basic cleanings, even if it's, perio cleanings, under $1,000. Most of the price points we see with these plans are kind of in that $400 to $500 range annually. So it's just something that perception of cost, patients don't know what they don't know. The number one reason, and the membership plans are really flipping the script right on its head with this. The number one reason they're purchasing the plans is because they find that a membership plan has good value for the money. They can very transparently see, what's included in the plan, what they're paying for it, what they're getting out of it. So these are becoming very, very popular for patient care in general. The entire subscription-based model and concierge medicine model has increased over 100% year over year the past 7 years. So love to have this data from not only internally, but through McKinsey reports as well. What's your real opportunity here? It's definitely for that untapped market out there that don't see a dentist. So 80% of uninsured patients don't see a dentist. A lot of seniors do not have dental insurance. My parents were a very good example with that, of lived their entire life with an employee benefit. And then once they retired, what do? Well, going to an insurance company, if you're over 60 years old, it's a nightmare. You're going to be paying close to $75 per person per month. That's going to be with a $1,500 cap. The right choice for anybody is to pay your doctor directly. So direct primary care is a very, very big thing, very popular in the retiree segment of the market. After that, definitely self-employed patients. So, I've been a entrepreneur my whole life and owned various different companies. I've never had a dental benefit, right? So because some of these companies just start out, it was just me, you're bootstrapping things. You still need to see a dentist. So that gig economy type side of things is becoming more and more popular as well. Not just entrepreneurial owning companies or anything like that. Somebody that's a freelance designer or might drive for Uber, as a gig economy worker. They don't have a benefit. Joining your plan is their dental benefit. The bottom line with these, increasing that patient care and attaching that patient to your office will not only bring just more loyalty and more visibility to them. You're building that relationship because they're paying for 2 cleanings per year regardless of usage. So they're trying to come in and get those cleanings. They're seeing you more often. Trust becomes a thing. The relationship builds. That's what's leading to a higher case acceptance, actually up to, 2.5 times higher than a typical uninsured patient would receive. And then the retention side of it. We're seeing 90+% retention out of these plans in every single state, every single zip code. It is something that's very sticky. Patients are keeping up with it year after year. And for monthly options, it's kind of just they're on your plan until for whatever reason, maybe they move or change for whatever reason, but it's auto renew all the way through. So it does keep them attached to your practice. Going to get into the software just a little bit. What we've built out is it's a cloud-based SaaS product here to help you, like I said, really organize and scale your plans. You do get a success team that is one of the biggest parts of our program. All of our success team are former office managers or consultants. They'll provide you guidance from start to finish. And we're building out things a little differently here at DentalHQ. We realize that it's really up to your team ultimately to push these plans. So we want to incentivize them too. We've gotten feedback over the years that a lot of doctors would like to offer up or start an incentive program, and probably not just for this, right? You guys have all probably thought about some way or ways to incentivize your team along the way for anything. And so what we've put into place is an incentive package for your team. The idea there is follow our success team's guidelines and launch strategy. you will be successful with this. Your team will be happy because they're getting incentivized as well. It's something we stress highly, meet with them quarterly just to continue to move things along. Anything from team trainings, team refreshers for when you have new people, new employees come into the office. It's all there for you with the success team. Now, what we're doing with some of these other bullet points I want to hit on, consistently adding new solutions to the real world practice issues. Something we've come up with and are pioneering lately is membership plans for all, not just your uninsured patients. Let's get membership plans in your practice for your insured patients as well. And what that might look like is a perks program. It could be certain incentives off of or discounts off things like Zoom whitening or take-home trays, possibly sealant plans or anything extra that insurance might not cover. It could be a little discount off treatments and procedures for when the insured patient hits their cap. Ultimately, I think that one of the best things that Brett had come across and really thought up was, let's go ahead and block off some of the more sought after appointment times, like during lunch or first thing in the morning or later in the evening for your VIP members, for your perks program members. So we are consistently adding new solutions, little innovations to help your team, help you really understand how the health of your practice and the membership plan. But we want to open this up for all patients, uninsured and insured. I mentioned it earlier that the platform is incredibly easy to implement, not a big learning curve, but we do hold your hand through it from plan creation all the way through the team training and launch and thereafter, with the idea that we want to create a monthly reoccurring revenue for your practice. And if you're interested in getting new patients out of this, we have some features for that as well. To jump right into the platform here and give you guys just a high level overview, I'll follow up with an email. You guys are going to get this recording. You'll get a slide deck though as well, and some of the information I'm going to cover. This is what the dashboard looks like. So as you can see here, not to overwhelm you, this is all the KPIs, all the different widgets that are going to explain analytics, health of your platform. Two biggest things, and really what I know office managers like the most, the activity feed is going to give them a real-time update on anything going on with the membership plan. And then we do have integrations into different practice management softwares. That's going to bring in a little bit more detailed analytics, right? Because we can actually see what kind of opportunities you might have for the coming week. If you have 10 uninsured patients coming in this week, that's 10 opportunities to just present the plan to them. And go ahead and they'll make the decision whether it's right for them, but it's helpful for your office manager. This is a newer widget, so what we can talk after this and everything, but we're going to continue to build this one out with a little bit more functionality to where the office manager could say, okay, Liam Jones is coming in, and have a button right here that you could just one click invite that patient, insured or uninsured, to your plan. Right now, we're looking at upcoming non-member appointments that could be for your uninsured, right? But you get the idea there. Getting a little bit more into the implementation side, it's something that is no more than about a 30-minute phone call. I know we block off an hour for it, but a lot of offices are offering what we have here as active. Maybe it's a perio plan or an adult and child preventive care plan. Maybe it's one other plan that's specific to your demographic. If you have a lot of retirees, your senior plan might offer them a little discount off the monthly or annual dues. Maybe it's a higher discount off additional procedures because they're more likely to need restorative work. But we don't limit the number of plans you can have, and we have templates for all kinds of different offerings that might be applicable to your demographic. Like I said, the first three here, they're the general templates. If you have something more unique in mind, we can really build it out with you, create it from scratch. Maybe it is that perks program, and all this, just to give you the quick look at it, is where you can edit the plan details, offer up monthly and annually, or one or the other. Ultimately, you control pricing. We'll suggest pricing for you, but we can change that up, or we can even sit there and say, maybe you have some plans you want only internal and not the external or patient-facing side to see. All of this gets done in about a 5-minute just kind of data entry here with putting in these 10 UCR codes. So I had mentioned before that this is not a discount plan, very different. It's not a network. This is a membership plan with included services based on your full fees. These 10 UCR codes that we ask for, that's what we're going to base everything off of. Most offices will price it out at their annual plan at that, and then maybe add a couple more dollars for the convenience of paying monthly. I will say that 2 out of 3 patients are purchasing annual plans for our internal data. Families that tend to gravitate towards the monthly option though. With that being said, optionally, you can offer up some family discounts, family packages if you want. This is off the monthly or annual dues, the percentages. It's not going to be an additional treatment discount that they get extra or anything like that. And these are all the little nuances that we run through with you and probably your office manager during the plan creation call. Now, once you get your plan set up, from there we have a marketing and a launch strategy for you. And really excited to share that you guys are seeing some of the changes in our branding already, but we're actually going to build out a new marketing portal. Customization on that's going to be incredibly easy. You're going to have way more than we are offering, which is pretty good to start. But we'll give you things like these pricing cards, the info cards, your logo, contact information, plans and pricing. And these are 4x6, which you can drop into go bags you give your patients. So we'll try and coach you through, best practices to get new members. There's a lot of ways to just display it in your office though, where, no one's even addressing the patient. They're just seeing it on like a tabletop display with a QR code, window clings or wall clings for your office, all kinds of different options. And yeah, excited to get the new marketing portal out as well. But email and text campaigns are all easy and free things to do. Social media campaigns, we have a lot of digital assets to where, getting it on your website, using social media templates, all of those things are free, but there are ways to spread the word on your plan. And I mentioned getting it on your website here. That's always a big part of this. Scott White's office, I like his, very simple, good website, very clean and easy to navigate. You see his in-house membership plan link here. You also see it here. Most of the time, a patient new to the area could poke around a website, but a lot of times you guys would be your office would be directing them to this page. We have different landing pages, but the idea is the same. White labeled for you, what your plans are, what the pricing is, the inclusions. If you want something a little bit more, we've got some more built out landing pages to fit the feel of your website. Again, notice white labeled here, contact information, how to join the plan, and then of course, what it is you're joining, what's included. So this is always worthwhile, and to just kind of see a patient experience with it. All the patient has to do, whether they're doing this in your office on their phone or your team's doing it for them, it's filling out some basic information that your team already has, and then selecting the plans that the patient needs to be on. Just throw in one more here. And you'll see it's based on the birth date. It would populate the plans available. This is where the patient can see, who have I added to what plans, what's my subtotal. If you're offering a family plan or a family discount, that's where they would see that, and then the checkout. So from there, much like any other form of checkout, it's just adding some kind of a payment form that we could, auto renew. So credit cards, debit cards, of course, HSA and FSA cards do work for this. And then of course, attaching your bank account. Cash or check could be an option. Our team would, run through how that might look, but there is ways to verify that you actually did receive that cash. And of course, it would be an in-office payment only for an annual plan only. Getting back into the dashboard, what happens when you get a new member or a family of members? That's where it's going to be emailed notification. You would see it in the activity feed, and then of course have all the pertinent information, right here in the members tab for that family or for that individual. This is something that you have all your plan details here. Now, I mentioned the integration earlier, being able to see who's coming in for the week. The other perk for the integration, or kind of what I consider the main perk of that, is posting payments to your ledger. So depending on what practice management software you have and version you have, which we would verify all of this well in advance, Bertha pays for her and her husband, and that payment is going to post directly to your ledger. You still have to create the charge, but not a big deal. It's actually not even required that you have an integration. We've been running the software for years now without integration. It's just more of a nice to have. And then, of course, the added benefit of seeing what your opportunities are, with people coming in. I'll tell you this right here, we have full support team, and you have your account manager for all, anything needed or necessary with the patient. This is a great little button, though, that just gets directly to the point about which member you need help with. And of course, we cover all the functionality here, but like I said, everything you really need is right here in front of you. Reporting, of course, an important part. You're going to receive a monthly deposit. The payout report will match up directly with that deposit of all of your patients, what plan they're on, what they've paid, what we collected, and then, of course, direct deposit. We also have all kinds of activity reports that are just more convenience, and we're trying to provide you guys with every tool you need to make this successful, or to discuss with our success team how to be successful. So, we're just providing, activity reports. We can do custom reports. And so, again, we can get more detailed in some one-on-one conversations, but just want you to get an idea of how DentalHQ works for really making this an easy way to implement the membership plans. A couple of little innovative features that we had pioneered: Business Connect and Community Connect, just like what they sound like. They're ways to connect and get your plans in front of local businesses and just different local community organizations. Now, Community Connect, I definitely prefer that to Business Connect. Much more of a numbers game, right? That could be an apartment complex or a country club. It could be the retirement community. It could be a youth sports organization, right? Any group with hundreds and hundreds of people in it, we can very easily reach out to them, help you with, kind of a list to build, and just, kind of the different categories to target with this. But I'm sure all of you are thinking about, what you have in your immediate area that would be super easy to just offer the plan to. Not like you have to give them a group discount, but maybe you're part of that organization, like a church organization or something, and you want to give a 10% discount to your friends there. Business Connect differs just a little bit, and that's because the business can subsidize any amount that they'd like. They are not required to, but where most offices go with this first is to their specialists they refer out to. It's something that, their teams need to go somewhere for hygiene, so why not you, right? And this is something that a lot of times we do see a little bit of a discount, especially with that relationship with your specialist you refer to. But outside of that, it could be, we've seen landscaping companies, real estate brokerage type firms, they might want to chip in as just a little perk. And so they're allowed to do that. And we've covered all the regulatory and compliance, not only for the state of Texas with your regular membership plans, but also for these business type plans. And, not to overwhelm everybody, Business Connect and Community Connect are definitely something that it's more like, 3, 6 months in, 9 months in. Once you get your feet wet and really have a good handle on your membership plans and the software, offices will come to us a little bit later and say, I'd really like to tap into the Community Connect side of things. But again, that might be 3 to 6 months in before you hit that. We provide full training for everything, and especially, the Business Community Connect side of things, to make sure you're not wasting your time, right? You want to get something out of this. So we would like to see that for you as well. Last but not least, just to cover everything on the dashboard, we also have some in-house financing partner offices, or partner groups, I should say, that offer this up. And this was really our focus of, we know that most of you run Care Credit or some kind of third party like that, but a lot of people don't get approved by Care Credit. So what are they supposed to do? We don't want them leaving your office without getting on the schedule for whatever it is they need because of financing. So we have some guaranteed financing options where it's a no credit check, guaranteed approval. And so that's just, again, in an effort to increase patient care, increase case acceptance. Your patient's going to be a lot happier knowing that they can get the procedure that they're concerned about, right? So, detailed it out pretty good for you, but that's a pretty high level overview, and happy to talk with everybody one-on-one about just the different functionality and features of what we're providing and what TDA Perks endorsed us for. But want to get back into this side of things a little bit and just kind of talk through, if you're running your own membership plan or looking to run your own membership plan, what you might be interested in with us, or what you might want to do as far as a conversation with transitioning your current in-house plan over to our platform. Again, lots more organization, lots more scalability there. The turnaround time is typically about a week for an office. It doesn't take more than 5 minutes to just create an account. The plan creation, I throw 30 minutes on there. I know we block off an hour. If you have something more creative, we have time for you always. But the simplicity of this is build out some basic plans with some inclusions that patients want, like the 2 cleanings, the exams, the x-rays. Then let's get your team trained. Only an hour. Now that's something that your growth manager will do with you. They're the ones that your team can tap into and really help blow this thing up for you. These plans have a huge impact on dental practices and just the patient base there, which is why we started to expand into that kind of unlimited custom plans for all patients. We're really excited to be able to offer plans to insured patients, as well as where we started, and the bread and butter, the foundation of why we started the company was to increase patient care to uninsured patients in your community. Everything's automated, okay? So for everything from notifications, collections, integrations, that's all great. It's not more work for your team. The whole point is to take away those tedious things that they'd have to spend so much time on. Integration's not required. All the collections, though, and notifications are done through us, and they're all white labeled. We're never going to talk to your patients without your permission. So we are partners in this, and definitely want to make sure that it's set up the way you want it to be. The regulatory and compliance side, might be a couple people on the call that remember, even 5 years ago, there was kind of a gray area in Texas on, is this a discount plan organization or is this direct primary care law? We did get written approval from the state insurance board about how things are presented. They are all in terms and conditions. Nothing extra you need to do in the state of Texas. You just don't call it an insurance plan. You don't call it a discount plan. You can't pass it off as either of those. But we cover that stuff with you. Just a quick conversation about that as well. And then some differentiating factors. There's other platforms out there, not only just ease of implementation and ease of use, but we do have Community and Business Connect for some new patient outreach. We have the guaranteed patient financing. We have guaranteed payment on that. We even have guaranteed plan payouts. So there's no possible way that you could get taken advantage of or really not made whole on this. Again, conversation for another day, but we do have all the patients on 12-month contracts. We do tap directly into their accounts. They've given us permission for quite a bit to be able to collect. There's even guardrails in there that a patient wouldn't, join your plan just to get a discount on the crown that they need, turn around and say, you know what, I don't need the plan anymore. They'd pay you the difference, in what the discount was versus full fees. So again, quite a few guardrails around this, but what we've learned all in all is that these are really, really good patients. We're able to collect at a pretty unbelievable rate, and they're sticking with these plans year over year. The things that are definitely exciting that we're building out, the team incentive program, I know that will continue to develop, but we're really excited to be able to announce membership plans for all, and then incentivizing your team. That we think that's a huge value add for you men and women as practice owners. And then of course for what your team's able to do with these different plans. Definitely here for some questions, but I want to thank TDA Perks program again. I will get this out to everybody. My information is at the bottom. Please email me, shoot me a text, give me a call with any questions. And now I'd like to open it back up to Josh for any Q&A.
Thanks, Eric. Great job. Really appreciate the information. Well delivered. We do have some questions here. And again, ladies and gentlemen, you can type in your questions there on the right, and we'll make sure that we get them all answered before we wrap up. And as Eric said, this webinar is being recorded, so you'll have plenty of time to go back to it or send it to your colleagues. So a couple questions here, Eric. Let's see, how many members should I expect to sign up?
Sure, good question. The plan creation call and the team training where we're getting you guys set up and onboarded, that's where, first of all, we're gonna see how many active charts you have, in your practice. And then maybe this beforehand, maybe we can figure out an approximation, but let's just say for ease of math, 25% of your practice are uninsured and you have 1,000 active charts. Your opportunity there is 250 members. That's not where we're gonna set your goal though, right? There's about 75% of those 250 will immediately adopt the plan as it's presented to them. And then with some new patient outreach, maybe your goal is 350 members or something like that. The benchmark of what we would like to see for any practice, even a smaller practice that's maybe 600 or so active charts, is about 10 members per month. So what we would like you to expect is 10 members per month. Our success team is there to follow through with the launch strategy, offer the incentive program to your team, and as long as they follow those guidelines, they should expect 10 per month as well. So roughly 120 a year.
Great, and actually we've got a comment that I want to share now with you, Eric. So this is coming from Dr. McCartney, and his comment is, I think it's great that you mentioned Business Connect. This is one of the reasons why I would market my practice. I want to really serve fellow small businesses and owners. Great idea. So yep. Yeah, next question I have here is, okay, this is a great question. So how much extra work is this going to be for my team?
Right, we do get that question a lot. It's less work, especially if you're currently running a membership plan, self-administering it. It's something that things might be falling through the cracks, or not to suggest your teams aren't doing a good job, right? But if they're not making those renewal phone calls or keeping track of things, things are falling through the cracks. We're not suggesting you make them do more work. It's more like Brett found out, it's just let's automate things so that it's less work, less hassle, less to keep up with for the team. We do not want to add work to your team. So that's the point of the platform, to make it easier for sure.
Right. Great. Another question coming in here. Okay, so why would I want to put my current cash patients on a plan?
All good questions, all pretty typical here. So it is just a matter of, you could do a little internal audit, so to speak. If you looked at all of your uninsured patients, and let's just say you have 100 of them, then you ran at your D1110s and see how many actual, exams, procedures, your preventive care procedures, more or less, right? Like the pro fee that you're giving these patients. Typically an office sees their uninsured patients once about every 9 to 12 months. Typical uninsured patients per the ADA come in once a year. When you attach that current active uninsured patient to your membership plan, they're now paying you on a more regular schedule. They're paying you for 2 cleanings on a 12-month billing cycle. That's tough to match up with. Most offices, even with the best uninsured patients, they're not coming in 6 months to the date and paying you those full fees. There's also, an uninsured patient is much more likely to ask for second opinions from another office, or just bounce around from new patient special to new patient special. Attaching all of your members, all of your patients to their membership plan does drive just bottom line revenue for hygiene, but also, almost more importantly, it's the loyalty side, the case acceptance side from your members for any additional procedures.
Great. Let's see, just waiting on a few more questions that I do see. Okay, I think you touched on this, but how are membership plans different than a discount plan and the legality around that in Texas?
Sure. Yeah. And that's what I try to just hit on it there in the end. We do have the written approval, written consent from the insurance board. So do want to repeat myself on that. But yeah, a lot of across the country as these membership plans were coming out, that was always a big question. You know, well, I don't want to offer a discount plan. This is not a network. It is not something where we're dictating what your reimbursement rate is. That's what a DPO is. It's a third party saying, we'll get all kinds of patients for you. You just need to offer 40% off or 30% off. Those are kind of a thing from the past. It's, you know, not something that I'm saying get rid of, but the data and what I guess the surveys about what patients actually want are included services. So a membership plan offers up that ability to have it attached just to your practice, just for your patients, and actually include the pro fee, the bite wings, you know, all that good stuff. As far as the legality side, you would need any DPO, like we would need certain licenses to manage that for you and everything. It is your patient, it's not our patient. We are just truly the software to help facilitate all of this and you know, like I've said multiple times, just to organize it and help you grow the plan. So little nuances, but pretty important ones for sure. Good question.
Okay, I see one more question here. So you got the plan in place. So the patient joins the monthly plan, excuse me, gets treatment and then stops paying. Great question. Something we need to avoid.
Yeah, like very low default rate. It's actually less than 1% a month. And I mean, I was shocked when our data showed that. So our ability to collect is there, first of all. The renewal rates on these things are 90+%. So again, the numbers are there to support, you know, the patients are good patients. They're not taking advantage. Now, what we've just implemented, well, we've implemented it. It will be available in the next coming weeks, is the guaranteed plan payments. What that means is that if a patient were to sign up for one of your plans, get treatment, come back for the 6-month recall, they're still an active member, and then all of a sudden they just fell off the face of the earth in month 9, left you holding the bag, right? That maybe they owed you a little bit for their preventive care there, for their membership plan. DentalHQ will pay you out the remainder of that contract. So months 9, 10, 11, and 12, DentalHQ would pay you out for the guaranteed plan. So really, there's no way you can lose on it at all. But there's other ways too. You know, I don't want to suggest that the guaranteed way is the only way. There's plenty of really easy conversations to make you whole without losing any money on it.
Great. So I don't see any more questions. Again, we've got plenty of time, ladies and gentlemen. So, you know, just quickly, you know, Eric, we really appreciate, you know, the information, you taking the time to be with us today. We appreciate everything that so far that DentalHQ is doing. Several articles have been written, sales videos. So, you know, we really appreciate the effort you're putting in to reach TDA members. You can reach me. My email is jepstein@tda.org. And let's see, our website is tdaperks.com. And, you know, Eric's got his contact information here. So I urge you to reach out to him directly. And, you know, I'm sure he can, you know, elaborate on the webinar and everything, all the different questions that were asked. But I don't see any more questions. So I'm going to end the webinar. And again, Eric, we really appreciate it. And with that said, do you have anything more to add?
No, not at all. Thank you very much to TDA Perks, you know, TDA as an organization, and to you, Josh. Thank you.
Yes, sir. Okay, ladies and gentlemen, have a great weekend, and we'll talk to you soon. Take care.